Medical explanation of carpal tunnel syndrome. Carpal tunnel syndrome is a condition that affects the wrist and hand, and it occurs when the median nerve, which runs from the forearm into the hand, becomes compressed at the wrist. This compression can cause a range of symptoms, including numbness, tingling, weakness, or pain in the hand and wrist. The median nerve is responsible for providing sensation to the thumb, index, middle, and part of the ring finger, as well as controlling some of the small muscles in the hand that allow for movement and coordination. Risk factors for carpal tunnel syndrome. There are several factors that can increase your risk for developing carpal tunnel syndrome, including repetitive hand and wrist movements, such as typing or using machinery, wrist fractures or dislocations, arthritis, thyroid problems, diabetes, pregnancy, fluid retention during menopause, obesity. Prevention of carpal tunnel syndrome. Preventing carpal tunnel syndrome is crucial to avoiding the symptoms and potential complications associated with the condition. Some effective prevention methods include maintaining proper posture while working, taking frequent breaks to stretch and move your hands and wrists, using ergonomic equipment, such as a wrist rest or an ergonomic mouse, exercising your hands, wrists, and arms regularly, maintaining a healthy weight to reduce pressure on the wrist, modifying or avoiding activities that place repetitive stress on your wrist and hand. Treatment of carpal tunnel syndrome. Treatment for carpal tunnel syndrome depends on the severity of symptoms and how long the condition has been present. In the early stages, non-surgical treatments may be effective, including wearing a wrist splint to keep the wrist in a neutral position, taking non-steroidal anti-inflammatory drugs, NSAIDs, to relieve pain and swelling, applying hot or cold therapy to the wrist, doing hand and wrist exercises to improve strength and flexibility. In more severe cases, or if non-surgical treatments are not effective, surgery may be necessary. The surgical procedure to relieve carpal tunnel syndrome is called a carpal tunnel release. This procedure involves cutting the ligament that is pressing on the median nerve to relieve the compression and improve symptoms. After surgery, physical therapy may be necessary to help regain strength and range of motion in the hand and wrist. In conclusion, carpal tunnel syndrome is a condition that affects the wrist and hand and is caused by compression of the median nerve. It can be prevented through proper posture, frequent breaks, ergonomic equipment, and regular exercise. If symptoms are present, treatment may include non-surgical options such as wrist splints, NSAIDs, and physical therapy, or surgical options such as carpal tunnel release. If you experience symptoms of carpal tunnel syndrome, it is important to seek medical attention to determine the best course of treatment for you. Subscriptions and likes are a big source of strength. Thanks for watching.